My vision for setting up Empowered was based on my earlier experience when I was working as an oncologist in University Malaya Medical Center. There, the majority of my patients came from very low-income communities, and I found that a lot of them had very poor understanding and knowledge about cancer and cancer management, and as a result, quite a number of them, based on their lack of understanding, had a lot of misconceptions about cancer. Since the birth of Empowered in 2009, we have reached nearly 45,000 people living in low-income communities in Klang Valley. 3 of these projects consist of a detailed and elaborate blueprint colon cancer screening programs. We are currently focusing on colorectal cancer, largely because it is the commonest cancer in men and now the second commonest cancer in women. The beneficiaries of our programs receive a one-to-one instructions from our trained volunteers on how to collect their stool so that the stool can be tested for microscopic amounts of blood.
Orang cakap itu nak cek usus besar kan, ada pensel ke apa dalam usus besar. Kalau tak ada program ini, kita tak tahu.
Saya dapat tahu pasal saya di rumah, blok D, saya turun pergi kedai selalunya. Ada sembot, ada pemeriksaan macam ni usus. Lepas tu saya pun besok tu saya cubalah pergi. Makcik dia ajar apa periksa usus besar. Pasal dia orang bagi apa klip tu kan, botol tu dia orang suruh periksa najis lah. Selepas tu orang dari program hari tu datang ke rumah makcik, bertanya makcik apa khabar makcik, kesihatan makcik lah. Makcik dapat tahu dalam najis makcik tu ada darah. Lepas tu makcik dapat satu sampul surat untuk pergi buat temu janji di hospital. Saya bersyukur kerana ada program ni membantu saya dan masyarakat di sini.
Saya memang suka ada program macam ni. Kalau kita nak harapkan kita punya bajet, memang tak ada. Nak pergi pun tak ada. Kita orang sini semua orang susah-susah. Ibu tunggal, macam saya pun ibu tunggal. Saya bersyukur sangat Empower Group ni buat program macam ni.
是有一个马来人管理人来通知我们，他告诉我说今天下午楼下下面有那个检查那个大肠癌的东西，我们就下去了。当然有点害怕咯，因为如果是中了要很多钱来医哦。 而且自己的本身人又很觉得辛苦，因为我们对这个癌症的东西没有什么了解，没有什么明白样子，因为他们解释给我们听，听又有听过，本身没有做过。如果是需要这样子的，就不用去了，因为这个是对于我们穷人家来讲益处很多。
I have an ideal that healthcare is for all, regardless of race, creed, and socioeconomic status. These ideals are imparted to our empowered staff and volunteers during the training sessions and training workshops. This is so that our programs are carried out by us, by our staff and our volunteers, with care, with compassion, and with professionalism.
There's advertisement about Empowered, so I got to know Empowered and register as a volunteer through the Facebook group itself. I have been with Empowered for 2 years now. I volunteered for 2 programs conducted at 2 different places. Basically, I got to learn more about communication skill, dealing with a range of different type of personality and different type of person.
So I learned about Empowered and the colon cancer screening project through my club, which is the Community Service Club, when 2 years back then when I was a committee member. During my first time, I got to see like what a whole screening project is, the whole flow for a big scale screening project is. And besides that, I get to learn more about colon cancer. Besides that also, I get to actually enhance my leadership skills by actually leading the volunteers from IMU.
I feel very happy because I can contribute to the community, and I feel very satisfied when seeing the patient having benefit from me. I mean, I can direct contribute to the community. This is what I'm satisfied with.
Once blood is identified in their stool, our beneficiaries will receive one-to-one counseling from our trained volunteers so that our beneficiaries are made aware of the results of their tests. In addition, our trained volunteers will also call up our beneficiaries 1 or 2 days before their hospital appointments so that they are reminded about their medical appointments. And at the hospital, our volunteers are also there to hold their hand in order to allay them of any anxieties or fears they may have. For some subjects with particularly more anxieties than others, they may have some reluctance to even come forward for medical appointments or even to have a further test like a colonoscopy.
Saya memang suka Empower Group ni, bawa kita dari awal dia check kita sampai kita pergi hospital Selayang, ambil kita, hantar kita, bawa kita pergi jumpa doktor. Memang very good.
In our programs, we usually collaborate very broadly and widely with like-minded organizations, whether it be colleges, universities, other welfare groups, and even corporate groups. We bring all these people together in order to bring about the mission of Empowered.
I get to learn some soft skills that we cannot learn from the lectures, such as communication skills and counseling skills. I would recommend my friends to join this community project because firstly, we can contribute to the community, and at the same time, we also can learn about communication skills and leadership skills.
I would really encourage more medical students especially to volunteer themselves in this program. Felt that it's a social responsibility to not only gain profit from the community, but in a way that we have to give back to them.
So what I will tell the others is what I feel that this is the right thing to do for the community, that we are playing our parts. And also this project is different from most of the other projects that we get to play a major and a significant role in the whole screening project itself.
During our colon cancer screening project, we realized that the students that have been with us are very enthusiastic about the project, and therefore we realized that this opportunity for us to train them so that they can become our future leaders. We will give them trainings like leadership skills training, communication skills training, to equip them so that they'll be able to help us to train more volunteers. We'll be having a health awareness campaign whereby the students, select the students, will help us to organize and plan the campaign.
So essentially, in my vision for Empowered, we would like to bring cancer programs, which includes cancer screening projects and personalized support programs, into the homes of low-income residents in Malaysia. My message to the Malaysian people about cancer is that there has been so much advancement in the area of diagnostics and medical management of cancer. With better early cancer detection measures and better treatment methodologies, more lives can be saved and quality of lives optimized as a result. I encourage Malaysians to make better decisions about cancer based on credible sources, whether it be about screening or about cancer treatment. Please visit our website at www.empower.org.my so that you'll be able to work with us on carrying out the vision and mission of Empowered to make possible more information and support programs accessible into low-income communities. So if you have the passion to empower the residents of low-income communities living in Malaysia about cancer, the treatment and screening options, please visit us and work with us at Empowered.